मिनट बात करूँगा, 1 मिनट बात करूँगा।
ठीक है सर।
जी अस्सलाम वालेकुम। अल्हम्दुलिल्लाह सर, आप 11 बजे मेरे पास आ जाइएगा, ठीक है, डिजिटल लैब में, फर्स्ट फ्लोर पे। जी ठीक, ठीक है। अच्छा मैं स्टार्ट कर रहा हूँ। हेलो,
यस सर, स्टार्ट करें सर।
औज़ुबिल्लाहि मिनश्शैतानिर्रजीम, बिस्मिल्लाहिर्रहमानिर्रहीम। So our today's topic is the role of nutrition and lifestyle modification in cardiovascular diseases. Okay, so there are two things, but both of the things are in fact related to each other. That how can we prevent the cardiovascular diseases, or how can we minimize the risk of suffering through the cardiovascular or cerebrovascular diseases, the both. So we are concentrating on two things: the role of nutrition and second, the lifestyle. What is lifestyle? Is we have to see here what is the relation of health and lifestyle with each other. Okay, what is the nutritional epidemiology, and what is the relation of nutrition with the cerebrovascular diseases, the cardiovascular diseases, and then what is the WHO stance about diet, cholesterol, and coronary heart diseases. Okay, nutrition or malnutrition. Malnutrition is an extreme form of the poor nutrition. Malnutrition does not means that undernutrition, that what most of the time that is being that is being most commonly taken as the undernutrition, but it is not only the undernutrition, it is the undernutrition and overnutrition both, and that means the wrong nutrition. And malnutrition impacts the daily life of individuals and families in community, and has wide-ranging serious effects in healthcare settings that results in high financial costs. So not only affecting the health status, health situations of the community, but the financial and economic situations as a result of, as a drastic results of those undernutritions that are there. Oral nutrition supplements may provide, maintain, or improve nutritional balance in the patient with malnutrition, but that are not suggested or recommended for as the first line of the nutrition, and the first line of the nutrition should be in the natural way. Now you see, this is an example of the undernutrition, malnutrition, and there is undernutrition, a state of the deficient energy or the protein intake or absorption. And it may be both. The intake is low, or intake is there, but the absorption is not there. So both the way. And it may be due to the failure of food supply or intake, or a disease, or deliberately fasting. And this is characterized by, you can see here the weight loss, body composition changes, and changes in the organ functions naturally if the essential nutrients are not being there. So the state metabolisms has to be converted towards the reverse one. Instead of the supply of glucose from the nutrition, it is being extracted from the fats and leading towards the ketoacidosis, etc., etc. So now you see this undernutrition may be of two types. Number one, the failure of the food supply or intake, or number two, where the food supply is sufficient, but this is not being utilized or absorbed by the body as a result of disease. And this is deliberately fasting comes here again into the failure of the food supply. So this is called the primary undernutrition, and the secondary undernutrition. Primary undernutrition, where the food supply is not sufficient, and the person is undernutrited because of the less food supply. And this is the most commonest type of the undernutrition that is present worldwide, especially in the children's. 95% of the undernutritions are the primary undernutritions, that is the deficient food supply. Only the 5% are there which are the secondary undernutrition, called the secondary undernutrition, which are due to some diseases like the malabsorption diseases, malabsorption syndromes, the Crohn's disease, and there are ulcerative colitis and other diseases are there. Some symptoms are similar in the both. This is a very sad story, and this is a picture which won the Pulitzer 1994 award. Okay, this is the award which is being given to the best picture of the year, and this is a picture of taken during the famine of Sudan, and this was being in the mail. This photo won the prize in 1994 during Sudan famine. And the picture depicts famine-stricken child, and this child is crawling towards a camp of the United Nations where the food supply is available there. And then picture was taken by the Kevin Carter, and this picture won the Pulitzer Award there. What happened? The child who is dying of the famine, of the fasting, of the deficient food supply, is crawling towards the food camp of the United Nations, and this vulture is waiting for his food, waiting for this child to die, and he may make him his food. This photographer, the Kevin Carter, took this picture, and then what he did, he left the place as soon as the photograph was taken, and he don't know that what happened to this child after that. And this was a crime in his part, and he felt under depression, and after 3 months of taking this photograph, he committed suicide. So this is an extreme example of the undernutrition again. And then you can see the other corner of the life, other way around, that the overnutrition, how it is, how it can affect the both are not good for the health. Both have their own ill effects on the health and the life. So both of these are the malnutrition states, and they should not be there. So factors that contributes towards the poor nutrition status may be the poor eating, and it may be due to the appetite loss, and it may be underlying disease or the injury or the limited access to food. And as I mentioned before, these are the primary malnutrition, primary undernutrition. This is again the primary undernutrition where this person is not eating. He is not eating due to appetite loss. It may be secondary to the disease, but the main problem is that the supply of the food to the body is not there. So both of these aspects come under the primary nutrition, which I said is the 95% of the time. This primary nutrition is the cause of undernutrition, and then 5% of the time there are the ulcerative and there are the underlying diseases, which may be like I said, the Crohn's disease, ulcerative colitis, certain metabolic syndromes, etc., etc. Then it should not be like that, but it should be like that all the time. And it can be done by avoiding all these risks. Who peoples are at risk? Living at home, for the elderly, the old age peoples, and the very younger age peoples, both are at risk, at more risk as compared to the younger ones. And then old age peoples again having chewing or the swallowing difficulties due to the dental problems. They may be the chair bound or the bed bound, living alone, and there is no one to take care of them, giving them foods and diets at the time, and taking care of their requirements. And then they may again even if they are old age or younger age or not, they may have, if suffering through acute or chronic illnesses or the conditions. And then weight loss due to the undernutrition. Age is itself a risk factor, and socioeconomic deprivation, the poverty, is the very major risk factor for the primary undernutrition most of the time. So the costs of the malnutrition on the both sides, on the overnutrition and undernutrition, and this cost may be the personal cost or the financial cost, and this reduces the physical activity and the quality of life, and this heighten caregiver burden. And if you see this caregiver burden, and you cannot imagine right a few days back that for the two bedridden patients, I provided some caregiver who can go at their home and take care of them, the nursing persons, and they were taking 1,500 per day for 12 hours. So if someone is hiring two persons, one for the day and one for the night, it costs near about 3,000 per day, 1 lakh rupees near about per month. So this is one example of the caregiver burden. There are other aspects of this, and then the delay wound healing because of the non-availability of the nutritional resources that are required to heal the wound. For example, the protein deficiency and the deficient hormones. And then there is the impure immune system, again because of the undernutrition, increased susceptibility because of the decreased immunity. There is the increased susceptibility to the infection, and lengthen our hospital stays, again making them prone to certain infections, which are the hospital-borne infections or the nosocomial infections, they are being called, and then the financial costs and the burden of the family, etc., etc., increased mortality rate. And the mortality rate of each and every disease is more in the undernutrition individuals or the groups as compared to the normal individuals, and raised cost of the care that I mentioned here in heightening the caregiver burden, etc. And then you see older adults, why are they at risk? Their nutritional status is related to the social, economic, physical, and the environmental factors, and their nutritional risk factors are present there. They may have acute and the chronic diseases, they may have dental problems, isolation, and the other people, the younger ones, because of their busyness, do not have sufficient times for them, and this isolation, feeling of the neglect, then leads to the depression. Then there are different abuses and the addictions like the pawns and the gutkahs. Financial constraints because they are no more an earning member of the family nowadays, and they are dependent on the others. And you know that you have right in your epidemiology and demography, the dependency ratio, which is dependency ratio is that how many persons are dependent on one earning person of the family, and this dependency ratio of Pakistan is 4 at the time, means that on each and every earning member of the family there are 4 members who are dependent on him. So these financial constraint to these peoples, the older ones, then their medications, financial aspects, financial constraints of these medications, and then again the side effects of these medications, their functional status, and then weight loss as a result of these things. And then there is the immune deficiency as a result of this malnutrition, and you very well know the phenomena and the pathophysiology of this decreased immunity as a result of the undernutrition. Most of the time that there are the decreased numbers of the killer cell, and their decreased deficient functioning, decreased secretory IgG, decreased complements, decreased phagocytosis, decreased cell-mediated immunity, and AgE, antigen recall, and decreased T lymphocytes, CD4 and CD8, and lymphopenia, deficiency of the lymphocytes. And these all things leads to the immune defects associated with the malnutrition. So There is stress, sepsis, injury, inflammation as a result of these undernutritions, and you know that there is a balance in between the anabolic and the catabolic forces in the body, and this balance makes the life healthy. And these events will result in marked alteration in the adaptation to the prolonged semi-starvation. That if you are continuing starving on a low scale, then these catabolic effects may be more as compared to the anabolic hormones. They are the catecholamines, glucagons, the glucocorticoids, and other systemic local mediators, etc. So this balance is being lost, and as a result of the more catabolic activities, more catabolic hormone release, and less anabolic hormone release, there is a loss of the balance of these things. Then some clinical consequences of protein catabolism, as you know, is the impaired wound healing and the immune response to the infection. Then there is hypoalbuminemia, increased synthesis of acute phase protein C, C-reactive protein, alpha-1 acid glycoprotein, and the fibrinogen, decreased coagulation capacity, reduced gut function, intestinal bacterial translocation, and the muscle wasting. And then nutritional therapy, if you see that if you want the most best way of treating undernutrition persons, whether they are the old age ones or the children or normal individuals or the young, that they should be educated for their nutrition, the nutritional counseling, and their replenishments of undernutrition through the oral diets. The oral supplements may be given, but the normal diets, the day-to-day diets, the kitchen diets, as along with the nutritional counseling and education is the best way. And then along with the oral diet, continuing with this oral diet, if they may not take it sufficiently as because of say the dental problems, then you may give the medical nutritional supplement at the second stage if they are needed, that you are continuing with the oral diet as far as possible, as maximum as possible, and then replenishing the deficiencies to the supplements, the oral supplements. If this is not possible to give them the oral nutritions, then there is the tube feeding. And then if even the tube feeding is not possible, then parenteral nutritions are there. But these should be like this triangle, that majority of the population should be treated with the oral diet and the nutritional counseling, and then less majority may need the nutritional supplement, but very few minority and the very few number should go on the tube feeding and the parental nutrition. And you see there is no place of the parental nutrition in this triangle. This is just at the tip as a point. So if we consume risk increasing foods, our overall risk of cardiovascular diseases increases. For example, risk increasing foods, a high cholesterol diet, more sweets. So these are all the risk increasing foods. This will ultimately increase our cardiovascular disease risk. And similarly, if we neglect to consume risk reducing food, we are not using the foods which reduces the risk, and we fail to practice healthy behaviors like walking, like exercise, again our overall likelihood of cardiovascular health decrease. You will be less likely to have the cardiovascular health and more likely to have the cardiovascular diseases. So the 3 points here, that we have to decrease the risk increasing foods. We have to increase to consume those foods which are risk reducing, and we have to increase the healthy practices and healthy lifestyles. By practicing these 3 things, the risk of the cardiovascular diseases may be considerably decreased. So risk reducing consumption patterns include healthy foods in moderate portions, okay, ample antioxidants, and then adequate vitamins, minerals, amino acids, coupled with regular exercise, adequate rest and relaxation, and emotional wellness, the proper sleep, at least 6 to 8 hours sleep per day. And the result is the dramatic increase in the quantity of life and the quality, overall quality of the life both. And the quantity of life can be measured in added decades, and there are the tools to measure the quality of life, the activity, the work ability, etc., etc. Then what we have to do, that we have to increase the healthy foods in moderate portions, take ample antioxidants, take adequate vitamins, minerals, amino acids, regular exercises, adequate rest and relaxation, and less stress, emotional wellness. The risk factors for cardiovascular diseases, as you very well know, that are the high blood pressure, high blood fats, cholesterol and the triglycerides, overweight and obesity, diabetes, physical inactivity, cigarette smoking, gender and age, and the family history. Now you see there are a few risk factors here which are modifiable, that you can modify them, you can control them, but there are just some of the risk factors which are not modifiable. For example, you see this high blood pressure is in a way it may be modifiable or it may be non-modifiable in some cases, but it is controllable. So if someone is having essential hypertension, idiopathic hypertension, he may even control, so it is a modifiable. Then high blood fats can very easily be controlled through the dietary patterns and exercises. Overweight and obesity can easily be modified and controlled. Diabetes, most of the time, it is genetic and with the family characters, but it can be controlled even if it cannot be avoided. Physical inactivity is totally controllable and modifiable. Risk factor, cigarette smoking, nothing to say, everybody can avoid, should avoid. Gender and age is not controllable or not avoidable, and family history again is not avoidable, and this is unavoidable risk factors. Then heredity, offsprings of the parents and the grandparents with cardiovascular disease are more likely to have heart attacks and strokes. Gender, men are more likely than the women to have the heart attacks and have heart attacks at younger ages as compared to the females, and increasing age. 4 out of 5 people who die of heart attacks are over 65 years of age. So then physical inactivity, regular aerobic exercises plays a significant role in preventing heart and the blood vessels. And then exercise also helps control of the cholesterol, high blood pressure, atherosclerosis, etc. Cigarette smokers have more than twice the risk of heart attacks as non-smokers, and the risk of sudden cardiac deaths is between 2 to 4 times more uh, in the smokers as compared to the non-smokers. Then high blood cholesterol levels, especially the high LDL, correlates with the increased risk of heart attacks and high blood pressure. The extra burden on the on the heart causes the heart to enlarge and weaken the cardiomegalies, and weakness of the cardiomyopathies are there. Obesity, it is itself not only a risk factor for the cardiovascular diseases, for the hypertension, but for the diabetes and the joint disease, and to many type of the cancers as well. So obesity is a very dangerous risk factors which predisposes to many diseases, not only the diseases but the cancers as well. Then the diabetes mellitus is itself, obesity is a risk factor not only for the hypertension, the cardiovascular diseases, for the diabetes, and diabetes itself a risk factor for the cardiovascular diseases. And statistics denotes that 80% of the people with diabetes die of some form of the heart or the blood vessel disease because of the myocardial infarctions or the cerebrovascular diseases, strokes, etc. And Other 20% may die of another disease like the kidney failures, etc., etc. Stress is a potentially significant risk factor, particularly in conjunction with one or more other risk factors that has been enlisted above. So, nutrition plays a role in 4 of the risk factors for cardiovascular diseases, and proper nutritional practices can decrease the risk factors of the high blood fats, the cholesterol, and the triglyceride. High blood pressure can be controlled with the nutrition along with medication if needed. Overweight and obesity may easily be controlled through nutrition and the healthy lifestyle, the exercises, and diabetes may be controlled through nutrition. And nutrition plays a major role, and either there is no need of the medications, or the medication can be minimized very much if a person is practicing a good nutritional practices along with the exercises and the healthy lifestyle. In these cases, these risk factors can be reduced or avoided with lifestyle changes. See, high blood fats, cholesterols, or the triglycerides. High blood cholesterol level raises the risk of atherosclerosis. Atherosclerosis is a process which causes a narrowing of inside of arteries and a reduced blood flow. And this can begin at an early age. Now, high blood cholesterol has been directly linked to an eating pattern high in fat, particularly saturated fat. There are very little cases of the hypercholesterolemia which are not directly linked to the eating pattern. They are the familial hypercholesterolemia or the hyperlipidemia or the familial hypertriglyceridemia, but they are very minor percentage of the total hyperlipidemias or the dyslipidemias, and the major portion of these hyperlipidemias are related to the dietary pattern of the person. And then fats in foods, they may mixture of the 3 different types. And these you know very well: saturated, monounsaturated, and the polyunsaturated fats. And that depends on the bonds there. And the saturated fat is not good for health. And we usually recommend to use the monounsaturated or the polyunsaturated fats to be entire there. But they are again in just the required quantities, not too much. And the different types of the fat have different effects on the blood cholesterol level. The saturated fats tends to raise blood cholesterol and should be limited wherever it is possible. Saturated fats are generally found in animal fats like the meat, fat, poultry, skin, full cream dairy products, and the many processed foods such as the pastries and the biscuits. So avoid these bakery items as much as possible. 2 vegetable oils have the saturated fats, and they are the coconut and the palm oil. So these vegetable oils should also be avoided. And then there are the monounsaturated fats. Monounsaturated fats may have a small lowering effect on blood cholesterol level if they are used to replace the saturated fats in small quantities, and they are found in some oils like canola and olive oil, monounsaturated margarines, avocados, nuts, and the seeds. So the recommended oil to be used in our kitchen are the canola oils or the olive oils. Olive oils, as it is very costly, so canola oil most of the time is being used. Then the polyunsaturated fats can also help lower blood cholesterol if they are used to replace the saturated ones. And some oils such as the sunflower, safflower, and the soybean oils and the polyunsaturated margarines, nuts, and the seeds and fish oils are high in polyunsaturated fats. Then tip just for the lifestyle that if you want to reduce cholesterol in your blood, just avoid the animal sources. Cholesterol is most of the time is being found there in the animal sources, the meats, etc. And if you try to avoid the triglycerides are most of the time present in these oils. So decrease the oil in your foods, you will decrease your triglyceride in your blood. Then hereditary factors can also affect the blood cholesterol levels, and a few people will have very high levels no matter how healthy their eating patterns is. And as I mentioned before, the familial hypercholesterolemia, familial hyperlipidemia, familial hypertriglyceridemia, etc., etc. For these people's, medication is essential to lower their blood cholesterol level. When the blood pressure is high, in the arteries, it's too high to put a certain strain on the heart because it has to pump harder. So the blood pressure in the vessels makes the heart to pump harder and increases the risk of the cardiovascular diseases. To help lower blood pressure, it is important to enjoy healthy eating, as mentioned before. Be physically active, lose excess body fats, no alcohol intake, and reduce salt intake. Then being overweight increases the risk of heart disease and stroke and many other health problems, including the high blood pressure, diabetes, gallstone, joint problems, and I mentioned before that many types of the cancers, like the cervical cancers, the prostate cancer, the cancer of the pancreas, etc. There are many, breast cancer, there are many cancers which are related. Their evidences has been found more in the obese person as compared to the normal weighted person. Generally, overweight is a combination of taking more energy, inputs are more than the body needs, and not using outputs are less, not using it up through being physically active. And as a result, this energy gets stored in the body and increases the fat and the weight. So the increased risk of heart disease and stroke in overweight people is probably because they more commonly develop conditions which are all important risk factors in their own, like high blood pressure, like high blood fats levels, and the diabetes. And these risk factors, when developed, they predisposes the heart diseases. There are two types of the obesities. They are being called the android obesity or the gynecoid obesity. Android obesity is the apple-shaped or the central obesity, where the central portion of the body is more prominent, while the gynecoid obesity or the pear-shaped obesity is the main deposits of the fats on the hip and the thighs. Out of these, this central obesity is more dangerous because here the fat is being deposited in and around the abdomen and in the center, in the viscerals, and all the viscerals, they are in the abdomen, and this obesity directly affects the viscerals, and that's why this is being considered as more dangerous. And unfortunately, this is the most common type of the obesity that is being found here in our regions and in the Asian regions. This type of the gynecoid obesity is more common in the African peoples, and you can see their lower portion of the body is more fatty as compared to the upper. In the Western region, the generalized obesity from head to toe is more common. Then diabetes is characterized by the raised blood sugar level, and it is definite risk factor for cardiovascular disease if severe or poorly controlled. Diabetes damages blood vessels generally, and arteries tends to develop atherosclerosis as a result. Now, please note an assignment here that what is the raised blood level? So in the fasting, what is the raised blood level? In the random, what is the raised blood sugar level? And in the terms of HbA1c, what is the raised blood levels? And it is being classified in three: the normal, the pre-diabetics, and the diabetics. And you have to read it, and we will discuss it for just a few seconds before starting the next lecture. Okay. So what to do? First of all, eat modestly until the discomfort of hunger ceases, and long before the discomfort of overfeeding. So as hadith, make 3 portions of your stomach: 1 for the diet, 1 for the food or the diet, 1 for the water, and 1 for the air. So this is how much you should eat. Second, eat wisely. What to eat? Mostly vegetables and the fruits. The best vegetable for promoting cardiovascular health are the broccoli, cabbage, carrots, spinach, onions, garlic, and tomatoes. And the best fruits are the oranges, grapefruits, and the grapes, cranberries, strawberries, blueberries, and other berries. So the vegetables and fruits should be eaten uncooked. so that vitamins and the fibers are intact. And on a macronutrient level, eat more proteins and carbohydrates, avoid fats and the salts and the sweets and the fast foods and the canned vegetable and commercially prepared packaged foods with the preservatives and the bakery items, etc. Exercise regularly and sensibly, and regular physical exercise strengthens the cardiovascular system, reduces hypertension, improves blood cholesterol profile, and fights atherosclerosis. In addition, regular exercises reduces the risk of obesity, which in turn reduces the risk of diabetes and other conditions that are related to increased risk of heart disease. So you are exercising, it is reducing the risk of obesity. If obesity reduces, it is reducing the risk of diabetes, hypertension, hyperlipidemias, and all these reducing the risk of cardiovascular heart diseases. And start with the less vigorous exercises as per routine, as for example, say half hour daily or 35 minutes daily walk. Walk means the brisk walk. Now you see, start with it, but try to increase it. If you want to maintain your weight as it is, then you have to walk, brisk walk 35 minutes a day. But if you want to decrease your weight, then your exercises would go as long as 70 minutes a day. And this is not possible to reduce the weight for a walk of 35 minutes. And then, see, exercise is not a one-time fix to the problem, but a part of the life, part of the transformation from sedentary lifestyle to a healthy, active lifestyle. And nowadays, I assure that most of the persons are sedentary lifestyle because of this lockdown, etc. So you should be very competent to exercise daily at your home and not to increase weight during these days. Then you must take the vitamins, minerals, and amino acids. Vitamin E, it strengthens the immune system and heart muscles, improves circulation, reduces the risk of clots, preventing thrombosis, and destroys free radicals. Vitamin C is an important antioxidant and it boosts your immunity. Vitamin B6, B12, and folic acid deficiency has been linked to the heart disease, particularly blocked arteries. And then additional antioxidants you should take. Alpha lipoic acid reduces the risk of heart attacks, lowers LDL cholesterol. Beta carotene reduces the risk of heart attacks and stroke present in the carrots, etc. Grapeseed improves vein and capillary circulation and lowers cholesterol. Then there are the minerals. The magnesium contributes to proper functioning of heart muscles, keeps heartbeats normal, reduces angina. Eat food containing calcium for your healthy bones, and eat foods containing iron, so anyone should not be anemic. And then there are the hormones and amino acids. DHA, the doxahexaenoic acid, prevents unwanted blood clots, controls insulin, destroys free radicals, and helps to reduce the body fats. And the human growth hormone plays a potentially significant role in strengthening heart muscles, reducing atherosclerosis, and fighting obesity. Effective human growth hormone releasers include arginine, ornithine, L-arginine, L-glutamine, L-lysine, L-arginine, niacinamide, gamma aminobutyric acid, GABA, etc. So there is a definite need of the good hydration and important for all 1.5 to 2 liter fluid per day. And this is the third form of the food, ensuring one glass every 9 kg is required. Ensuring that older people are well hydrated is essential. Dehydration by as little as 2% loss of body weight results in impaired physiological performance performance responses. In extreme cases, mental confusion that has interpreted as the onset of senility has been reversed by adequate hydration. So that was not the senility, that was the dehydration. And tips on the healthy aging: eat an enjoyable and varied diet, watch your weight and stay active, eat plenty of the fruits and vegetables, opt for healthier fats, eat plenty of fiber, reduce your salt intake, eat calcium-rich foods, boost vitamin B through varied diets, especially the fruits. These calcium-rich foods are the dairy foods. Keep well hydrated. Look after your teeth. Little sunshine is good for you, especially for the vitamin D levels. No alcohol. Don't smoke. Get enough sleep. Keep your brain stimulated and use it or lose it. This is the phenomena. This is the principle. Keep active. Cardiovascular disease is not an inevitable consequence of aging. Okay, it is not necessary that all old age people should have the cardiovascular diseases. This may be prevented through proper nutrition, prudent supplementation, adequate exercise, and avoidance of risk-related factors like tobacco, obesity, etc. Individuals in their upper decades can reduce the risk of cardiovascular diseases to the levels of youthful men and women by avoiding all these risk factors. So the reminder is that an estimated 25% of the people who have heart attacks have no previous symptoms of heart trouble. And atherosclerosis is responsible for most of deaths attributed to heart attacks. So conclusion is that nutrition and lifestyle can have a profound impact on healthy life expectancy. Start being young. A healthy diet and regular physical activity will aid recovery from illness, quick recovery from illness, and help protect against health problems such as anemia, diabetes, osteoporosis, heart disease, stroke, under and overweight, constipation, and other digestive problems. So if someone is taking proper fibers in that diet, he will not suffer through constipation. With longevity increasing, healthcare costs are set to escalate out of control. So this is good for decreasing the cost of the life. So now you can see your Eat Well plate, how it will be. Use Eat Well plate to help you get the balanced diet and right balance. It shows how much of what you eat should come from each food group. So you can see majority of the food group that you should eat or should be the fruits and the vegetable. 33% of your diet, your plate should be fruits and the vegetable. The 33% should be the staple diet, that are the bread, rice, potatoes, pastas, roti, etc., chapati. And then in the rest 33%, you are having the portions of the milks and dairy products, very little fat and the sugar, and very little place again for the meat and the eggs and the beans. So this is a eat well plate. So major portion, and we are deficient of these type of the things. We take too much carbohydrates, we take too much fats, and we take too much these food and the drinks which are high in fats and the prepared or the processed foods. We are deficient in the milk and the dairy products as well. So try to increase this and make your diet, make your plate a balanced one. And now this is up to you that you want to be like this or you want to be like this active lifestyle. So if any question is there, any person if want to take the supplements of omega-3 fish oil or as polyunsaturated fat is not recommended. A normal person, a younger person especially, is not recommended. If you ask this question for the older ones, I will say yes. But taking these foods, as I showed you, the triangle of the nutrition, and you saw that the basic portion, the base portion is through the oral nutrition and the proper food, but it can be taken if it is needed and a person is not taking proper food through his diet, as there is the lack of appetite and the digestion problems in the old age persons, and they cannot take very large quantities or sufficient quantities of the foods. They may be given there. The supplements most of the times are being given here where these portions of the foods are available in the normal foods. If someone is taking proper vegetables and the fruits, he is in no need to take the vitamin B supplements or the folic acid supplements. If someone is taking proper dairy products, the milk and the yogurt, etc., I should not advise the butters as a daily product. Milk and yogurt, he will not need calcium supplements. If someone is taking proper sunlight, he will not need any vitamin D supplement, etc. Any other question? ओके बेटा बंद कर दो
सर। टाइम हो गया सर, हैंड कर दूं?
जी कर दीजिए।
ठीक है सर, थैंक यू सर।